So here's the phase 1B, the next phase. This is next month, we hope. And this is what's under consideration. This is what was discussed last week and what we believe will be finalized as early as Wednesday. And so last week, this was what was discussed. Plan 1B, 2 tiers. You remember on our Plan 1A, there are 3 tiers. If I've lost you, you're paying attention. If I haven't lost you, you might not be paying attention, except to say there's populations, top line, and there's subpopulations. There's prioritization, and then there's categories of prioritizations within those priorities. And so this is a slide that simplifies that a little bit. And these are Plan 1B folks. These are high-risk individuals that live in high-impact geographic areas that obviously can impact the spread to their coworkers and or the public. That was at least the sentiment from the drafting guidelines work group, to which was the thrust, the value proposition that went into the phase 1B guidelines. 75 and over will be the top sub priority in terms of population. Workers in education, that's our teachers, but across the spectrum. Workers in education, childcare, emergency services, food and ag, the food supply chain. And that's farm workers, grocery workers, the logistics around food, the essential workforce we've counted on that's been there from the beginning of this pandemic, that's paid a huge price in terms of impact, in terms of spread, in terms of mortality and associated health costs since the beginning of this pandemic. So they will be prioritized in the phase 1B, tier 1. Tier 2 is 65 and over with underlying health conditions, people with issues of obesity and diabetes and the like. Workers, again, in transportation, logistics, commercial sectors, critical manufacturing. We get into high risk, incarcerated individuals, homeless, and the unhoused. Phase 1C, this is under consideration. They'll be discussing this on Wednesday. They'll be approving 1B, we hope as early as Wednesday, unless there's some deviation from the current schedule. But Plan 1B should be locked down on Wednesday. Plan 1C will be discussed. That's the next phase, and that's what I wanted to socialize and provide for you, a little preview of that. And this gets to folks 16. This may include many more people watching. 16 to 64, this would include someone like myself. 16 to 64, people with underlying medical conditions, workers in water, waste management, defense, energy, you can see on this list, community service providers, IT, financial services that, again, are high impact. So that will be part of the conversation. The advisory committee will discuss this preliminary phase 1C plan. They'll make adjustments. We'll make accommodations, because we're getting a lot of people lobbying, a lot of people providing insight. IDD community, which is developmental disabilities, individuals, developmental disabilities that have higher, those are impactful subpopulations, and people are coming in, making sure that we don't forget critical populations in the state. Again, all with an eye on equity, all an eye on regional equity, not just racial and ethnic equity, social economics, always considered as well. And so that's the plan for the Vaccinate All discussion this Wednesday. And again, hope you tune in. Again, if I've confused you, you can have a more simplified version of all this this Wednesday